ma'am. No issue, ma'am. Now you're finally audible, ma'am.
So I hope you're doing
So,
well.
ma'am, yes, ma'am, I'm doing well, ma'am. Thank you so much, ma'am. Ma'am, yes, you're very warm welcome on this session, and thank you for so much for this opportunity for our budding home pets to learn something about from your side, ma'am.
Thank you
So,
so much that you invited me to this platform so that we can discuss something a bit.
yes, ma'am. So, yes, I give you a little introduction to my audience about ma'am. Yes, so here in front of you, Dr. Tania Chatterjee, ma'am, from Delhi. Currently, she is in Delhi, and she is working with CCRH in New Delhi under Ministry of AYUSH as a senior research fellow, and also working as a gold medalist in MD from the same college where I have completed my BHMS. And I know ma'am very personally. She taught me so many things about Materia Medica. So yes, ma'am. So, ma'am, सेशन स्टार्ट करने से पहले मैम I want to ask a question about your journey, ma'am. So, how's your journey till date, ma'am, with this homeopathy? So,
Oh,
please
actually,
motivate us,
that's
ma'am. Motivate us, ma'am.
Devi,
Yes.
you asked me a really a great question. I was never able to face this kind of question. The journey starts
Yes,
from
sir.
2010 and it's now I'm standing in 2022, almost 12 years. I think one of the longest relationship in my life with homeopathy. And trust me, it never ditched me till the date. And I hope it will not ditch me in future as well. So it's been a
Yes, ma'am.
wonderful journey with homeopathy. 12 years, I'm totally in love with homeopathy. It's an awesome pathy. It's, like giving a lot. So yeah.
Session with the our topic that the how to grab the crux of that Materia Medica in our practice for the prescription. So, ma'am,
Yes.
how you guide us on this topic?
Okay. So let's begin. Actually, I think Devi, I know you from past 3 years, right? And we met first
Yes, ma'am.
in our periphery, right? So I don't know how many people are watching. So I just want to share a very special thing about Devi. And he is a very keen learner. मतलब whenever we just used to visit any peripheral, I think he was the most keen learner कि मैम आप ये क्यों दे रहे हो मतलब I have found something that zeal that this person really wants to learn. So I'm really very much blessed to have a junior like this. मतलब even we have talked at night ke Devi knocked me like ma'am how to read Materia and all this stuffs. So I think
Yes, ma'am.
Devi is one of the person who can be a motivation to learning. So I think the people who are watching and who are in touch with Devi, I'll say please इस आदमी से जुड़े रहना. आपको कुछ मिले ना मिले मोटिवेशन और सीखने का जो जिल है वो तो जरूर मिलने वाला है. So I
Yes, ma'am.
really wish you all the best for your this
Thank
initiative
you so
that
much,
you
ma'am.
have taken for this online platform. So let us start with
Yes, ma'am.
our topic of this today. So see, today we'll be discussing about the practical orientation regarding the prescription, right? And if any of the audience have any question regarding the today's topic or anything else, they can always ask,
Yes,
right?
ma'am.
With Devi's permission, if he allows, right? So see, when my journey started from 2010, we entered to the course of the BHMS. In the first year, I think our most fearful, subject was Materia Medica. How to
Yes,
approach
ma'am.
this subject. I think it is a nightmare, and I was not even able to sleep just because of this subject. This subject, keep me awake night after night because I was not able to know like how to get the nerves of this subject. I used to cry. Okay, like I just need to learn this subject and nobody is there how to, like get the help. So first year and second year, it's been very tough to know this subject, to understand the subjects. It will take at least 3 to 4 years just to get the nerve of this subject. Then you will, slowly learn that how to, reach to this core of the subject. I think that is also very lesser time. 3 or 4 years is not enough, but at least we'll get a bit of the grip. Because see, in a BHMS you have to write 4 papers, right? So and practically you have to pass the each and every paper, and you are
Yes,
handling
ma'am.
the subjects, vast subjects like anatomy, physiology, surgery, medicine, what not. So you have to give your full in the other subjects as well. So regarding Materia Medica, if there is any student from first or second year, I think now there is no Materia Medica in first year, right? I think it has been dissolved. So
Yes, ma'am.
you will be getting in touch of the organ and Materia Medica second year onwards. So it has
Yes,
become
ma'am.
more
From second year.
difficult. Yes, it has become more difficult for the students to get acquainted with this subject. So the
Yes, ma'am.
a student who is starting from the second year with the Materia Medica, see, there will be so many books to like write the exam, because at the end of the day you have to write the exam and pass the exam, right? There is no other
Yes,
way.
ma'am.
So you have to go through the previous year question papers, whatever questions they are coming, so you are making notes out of it. And for making notes, so don't follow so many books. See, what I did wrong, I'm telling you. From the first year I started reading Herring's Materia Medica. Devi, that was a disaster. And I felt like there is so many symptoms in Herring's Materia Medica. And I started reading each of the Materia Medica side. My teacher first taught me Silesia medicine, right? I started
Yes.
reading that Silesia medicine from Ellen's, Bori, Kent, Nash, Herring's Materia Medica. And trust me, it was a disaster. After reading so many books, you are not getting any single picture of that medicine. So don't do that. You'll just select some of the books, start with the Ellen's Materia Medica and keep side by side Boric's Materia Medica. And for
Yes,
the
ma'am.
introduction, Boric's Materia Medica will be having a introduction section. So that will give you an idea regarding the pathology of that medicine, where particularly a medicine is working, like is it cardiovascular system, is it a nervous system, dermatology, whatever. That will give a overall pathology. Okay. And side by side, for a better idea, you can refer EB Nash. Okay, so this 2 or 3 books you just need to be get acquainted with. And along with that, I'm forgetting the name of that book. I think Devi, you can remember, there's a like blue cover book for notes. I think people referred that book of a lot for making the notes. So I'm just forgetting the
And
names of.
Dubey?
Yes, absolutely. Dubey.
Yes, ma'am.
See, I started
Yes,
reading
ma'am.
that book, but somehow that book didn't suit me. But for writing the exam, you can refer. Okay. So
Yes,
that
ma'am.
is one perspective regarding writing the exam and passing the exam. And you need to have a touch of your seniors, because I think seniors are the best teacher for your BHMS journey to, get in touch with the subject. I was lucky
Okay.
enough that I got so many but seniors who actually taught me Materia Medica. So that was the thing. And whenever we'll be sitting at canteen during BHMS period, I remember my BHMS day, we used to carry this LS. This is my boyfriend since 2010. So still now, even if
Yes,
I
ma'am.
am traveling anywhere,
Very
I
old, ma'am.
always carry Alan. So Alan को मतलब छोड़ा नहीं जाएगा. It's always with you. So the thing is that you need to discuss with your friends. Okay, until and unless you will be discussing Materia Medica with your friends, colleagues, or senior, trust me, Materia Medica will not. It's not going to come under your grip. The more you will discuss, the more you will flourish. There is no other way out, no other rules to learn Materia Medica. Continuous discussion. Whenever you are getting any off time, just discuss. And I will
Yes, ma'am.
suggest you nowadays, see, at our time 2010-11, there was not that much YouTube videos and something like that. Till the date I follow Dr. Saptarshi Banerjee's so many videos. He has excellent videos on the cough, and I think cough is the one of the vast area where most of the homeopath fails. Because first of all, whenever a patient comes to your OPD, you just need to understand whether the patient is a case of COPD or it is an interstitial lung disease. Okay. And
Ma'am.
blindly we prescribe aspidosperma. I have seen. And you have to like differentiate, like, see, what is the function of aspidosperma? It is a simple bronchodilator, right? So if a patient is coming with a severe COPD, their aspidosperma may work. But if a patient who is coming in your clinic who is having interstitial lung disease, which we call ILD, where your aspidosperma won't work. So you have to understand
Yes.
this differentiation. If you prescribe your patient, advise your patient to get done a spirometry. In case of the ILD, interstitial lung disease, you will get a almost normal, spirometry in case of ILD. But in case of COPD, it will be different. So you have to differentiate between these two, where you need to prescribe Aspidosperma and where you need to prescribe maybe Blata orientalis or Justicia, whatever it may be. In that case, for the mother tinctures, Boric Materia Medica will be one and only helpful book. And along with that, you can follow Drugs of Hindustan, written by Dr. S.C. Ghosh. That is only
Okay.
the Indian drugs. So if you're willing to prescribe a patient, any mother tincture, follow these two books, either the last pages of the Materia Medica written by William Boric or the Drugs of Hindustan, S.C. Ghosh. Because in the books of Drugs of Hindustan, you will get a much broader picture of the drug, but in William Boric's Materia Medica, it will be written in a small way. So if you need to have more idea regarding it, you can follow this book. So this is regarding bit of your clinical orientation. So obviously, whenever you are going through your BHMS journey and you're practicing, the scenario is totally different. In BHMS, what we face, like, okay, write down the mental picture of the Nux vomica or the mental picture of the Arsenicum album. In clinical life, see, we don't get that much chance to get a mental picture of that patient. Okay, so whatever we ask, say, sorry, how is your temperament? Do you get angry very easily? What is the expression of your anger? Do you like to stay alone or desire company? These all are the vague questions. Excuse me. So whenever a patient coming to your clinic, the way he or she is talking, that itself will give you the mental picture of that patient itself. So you don't need to ask it differently. You the mental picture of that patient, like how the patient is coming to your clinic, how he or she is sitting, what is, even some people say ke, I don't have much faith on homeopathy, but still I came because I just really want to avoid the surgery. Let's see what happens. This kind of small talks now will give you the actual mental picture of the patient. Some patient will come to your clinic, he or she will first clear the chair wherever he or she is going to sit, or wherever she is going to keep her hand, she will clear that area. So that is giving a some kind of picture of platina, whatever you have read in the book of Allen, that haughty feeling, always that pride feeling, always nosy, this kind of thing. This way you need to get the mental picture of that patient. Sorry, so that is another way. So we will start with the thing with the case taking. I'm so sorry.
It's okay, ma'am. It's okay.
Like, I'm having so many cough from yesterday. That's why I was focusing on the cough problem. Okay. Case taking
Yes.
part, right? So whenever a patient is coming, we have to keep focus on few things regarding that the present complaints. So whenever patient is coming, do not miss few points. Just like you have to differentiate between the acute problem and the chronic problem. And believe me, Devi, nowadays patients are even coming to the homeopaths for the acute problems because they are well aware of the side effects of the antibiotics, the NSAIDs. So even on the first priority, they come to the homeopath. So you have to be very much aware of it, and you have to take the full responsibility of the patient. Just ask regarding the present complaints and regarding the duration, from how many times or how many days he or she is suffering. And definitely ask the mode of onset. How was it occurred? Like, was it sudden or was it occurred even previously? And never miss out that problem, how it started, like whatever was the causation, what we call in Allen, you will see ailments from, right? Ailments from, AILMENTS. So you cannot afford to miss that point, ailments from. So I learned from Dr. Saptarshi Banerjee, he always used to prescribe and used to write NBWS. That is never been well seen. Some patient will come, and if you ask कि आपका ये problem कैसे चालू हुआ, तो she will give you a picture कि doctor, like when I had my last baby and it was a cesarean section and I got some general anesthesia or spinal anesthesia, and after that I developed all this gastric problems, acidity. So yeah, I just developed this rheumatic problem, all this stuff. So that is your NBWS, the elements from that spinal anesthesia.
Okay.
You just need to get this point. So that will act as a causation. If you get this kind of causation, you can clearly filter. Whenever we're shopping in Myntra or some other apps, we put some filter, right? Like the price
Yes, yes, ma'am.
range, maybe the company, the brand, whatever. This elements from will give the filter wala thing. How will filters?
Yes, ma'am.
Suppose this elements from we got the spinal anesthesia or that laparotomy or any cesarean section, then and then we should have some images of the medicine, be it acetic acid, be it staphylos aureus. Okay, now your next job is that how to differentiate this staphylos aureus and this acetic acid. Then further you have to apply more filters. You are done with your causation, then you just go with the some other general questions. Like you can go to the either you can go to the generalities, you can get the
Yes,
generals,
ma'am.
or in case of acetic acid you will hardly get any generals. Okay, that cold, clammy sweat, this kind of things you will hardly get. But in case of the staphylos aureus, you can see that the person is having very sobered personality. He or she is talking very nicely, or he's even telling कि whenever I get angry, I cannot express, I suppress, I do overthink, I think and think day after day, but I never can express. So that will give you the picture of the staphylos aureus. This way you will be able to differentiate one medicine to another medicine. That's why Bonninghausen has told a very famous thing. Whenever we are taking any present complaints, right? That the duration happens, what is your present complaints? Like regarding the sensation, do you have any special sensation, any modalities, any accompaniments, whatever? Then you just focus on to the modalities. Whatever pain or coughing, whatever they have, just ask regarding the modalities. When it gets aggravated, when it gets ameliorated.
So, ma'am, I just asked a question in between. Ma'am, what is the elements from this complaint in your case? Like you
Yeah.
have something outside food or
Oh, okay, okay. You just want me to talk
yes,
about
ma'am.
something about cough, right?
Yes,
See,
ma'am.
that's a very, I think my cough has a very bad history. That is, in Delhi, the temperature is around 41, 43. My AC was
Yes,
not
ma'am.
working around 2 to 3 days, and I was all perspired. And whenever I used to hit the gym in the morning, there was AC. And again, I come back in the 41-degree temperature. I used to drink water. And जब मैं सुबह उठती थी मतलब नींद से आई वाज ऑल पोस्टपार्ड सो यू कैन थिंक ऑफ टू मेडिसिन्स वन इज चेक
Yes, ma'am.
पर्सपिरेशन जो कि मुझे बहुत होता है एंड एसी से
Yes.
आप सडनली आ गए धूप में द टिपिकल पिक्चर ऑफ द डलका मारा okay so dalka mara works wonderfully though I have not taken it yet so this way you can
That's great, ma'am.
differentiate one is the check
Okay.
perspiration and if the patient is telling that he or she is having a pool party he is partying under the pool over the head sun over the head you can think of antim crude okay
Okay, ma'am.
so yes this
Yes,
way
ma'am. We'll
you can
continue.
differentiate yes and if you want to add some mother tincture just see the character of the cough like if it is a very dry cough just like I have slimy mucus small of mucus so in case of if they are having any mucus go for bladder if it is a dry cough go for justicia see this is a mathematics 2 plus 2 4 almost all the time sometimes it won't work but mostly it is 2 plus 2 so yes I was talking yes so let's talk on the cough itself so
Yes, ma'am.
again just we are talking about the modalities right so ask that patient when your problem is getting aggravated or ameliorated Devi trust me मेरे फ्रिज में कोल्ड ड्रिंक्स पड़े हुए थे फ्रॉम 7 days एंड आई डोंट कंज्यूम सॉफ्ट
Okay.
ड्रिंक्स कल क्या हुआ माई लाइक बॉडी वॉज इन नीड ऑफ हैविंग चिल्ड फूड आई वॉज हैविंग cold water and that soft drinks I'm not even able to have any hot drinks or coffee something like that though I used to take lots of coffee even in the hot days but from yesterday I'm only taking the cold drinks, soft drinks, cold water, whatever it may be. It is a particular picture giving is the causticum. Causticum patient
Okay.
always get relief having some cold food, cold drinks. So if you're getting this kind of symptoms, you can give blindly causticum or in the evening aggravation. Think of causticum, right? If the patient is very much chilly, like sipping coffee or adrak de ke chai pee raha hai, and even I'm sitting under the AC, right? मुझे बहुत गर्मी feel हो रही है. If you know he is covering himself or herself with a clothes or blanket, just think of yourself, nothing else. Okay. And one thing you can consider regarding the cough paroxysm, you clearly see in the cuprum metallicum there is a cough paroxysm. Mark Sol cough paroxysm. There's a 1, 2, 3 cough paroxysm. Just count. Ask patient to cough in front of you. If he is giving single paroxysm cough, double paroxysm, or triple paroxysm, this work wonderfully. I have tried cuprum met for the 3 paroxysm cough. I have tried Maxol for this paroxysmal cough. So ask regarding the paroxysm. If you can go for the, there is a line written in Boric regarding Corallium rubrum. Okay, this is a gunshot like cough, like you're coughing.
Yes, ma'am. Continuous cough.
Yes, this is the Corallium rubrum. Some patient will give. This is the single paroxysm. Some will give stop. Double paroxysmal cough. Typical cough of cuprum met. So you just need to understand that patient, how he or she is, giving the picture. In between the talk, he or she is sipping up, like coffee or maybe water. Coffee might not be available in your clinic. He or she is sipping the water, and he or she is very much anxious. Very much anxious. Ke doctor, will my cough will get rid of it? Will your medicine work? Whether I'll be able to leave? See, I have this much family. I have to take care of them. Like so much anxious. Along with that, he or she is telling, I really feel, having that burning sensation in my throat. Typical picture of arsenicum album. This way, we'll be able to differentiate arsenicum album from phosphorus, phosphorus from causticum, from hepus. So that is the actual thing which you need to differentiate. Whatever Bonnie Hussain has told, that differentiating factor and modalities act as a very well differentiating factor. So that is the thing. You cannot miss out that causation, the elements from the modalities. And the mental you will get only from the behavior. How he or she is behaving, you never need to ask. Whenever something like that, if he or she is having in the past, just like the disappointment of love in Ignatia, Natramure or Calphos, he or she will never tell you on the first appointment. Whenever you will be able to gain the confidence of that person, on the second or third visit, the patient will tell you on his own. See, I have a breakup on that day, and after that I started this problem. I never had this kind of problem. This way you will get the actual causation of it, and after that you may change your prescription. And see, I have seen lots of things. If you need to confirm any medicine, never hesitate to open book in front of your patient. In this way, the patient will feel good. Okay, the doctor is referring or caring so much for me, and that he is referring the book. So that is a positive thing. So never hesitate. What the patient will think. I'm a junior doctor. I don't know anything. Don't do that. Patient will be very much happy that you are giving all the focus and attention. So do open your book with all full confidence. No, your case is very much rare and interesting. I will take care of it. So that's why I'm referring. So with full confidence, open your book. Whatever need, you just refer it. Okay, so that is the thing. In some things, see, we get so many complaints of the cyst, right? He will not give you any sensation, no modalities, nothing. It is persisting from 10 or 12 years or something like that. In that case, I will suggest you go with the particular chapter of any repertory where you are comfortable. It's better to use some modern repertory, be it Murphy, or if you are comfortable with BBCR, or if you are comfortable with the Kent repertory, you just go to a particular chapter. And if you're just having a cyst on the right cheek or left cheek or any hand, any position, go with that single medicine. It will act wonderfully. In some cases, you won't be able to get the full picture of the patient. That is why it is mentioned in organ of medicine one-sided disease. It's not always necessary it will be a like mental disease or something like that, but some
Yes, ma'am.
patient
Yes, ma'am.
patient you will get where you won't get any complete clinical picture. A cyst which is not painful, a wart which is not painful, what kind of picture he or she will give? If you ask them regarding the generalities, they will give you vague answer. They don't have any desire for food, nothing, thermal relation, nothing. So in that case, you can refer to a particular like repertory, go to a particular rubric and see the gradations. If you get some of the if you see like lots of medicine over there, 5 6 or even 20, take up the bold or the highest grade remedy and just try to like somewhere cross questioning, like how did it appear. And if you're not getting any history, try to get inside, like if you get at least one or two symptoms at least to prescribe something. Okay, so that will help you for the first prescription. And whenever you'll be done with the first prescription, on the second visit, some of the other will give you some of the symptoms. Maybe some of his or her old symptom will come back. Now he or she will tell, okay, oh yes, I forgot to tell you, I had a complaint of constipation. But that patient was so much accustomed with the constipation, he didn't consider that problem as one of his problem. So he didn't
Yes.
find to tell this problem. So I think it had happened with you as well. So this way we will get the
Many time, ma'am.
complete picture of that medicine. And in that case, I'll suggest don't even hit your head with the miasm concept, everything. Just simply go to a thorough, neat and clean case taking, right? Apply the
Okay.
modalities thing. If you are okay, if you're getting the symptoms of the generalities, apply it and make a short totality. That's it. And whenever, if you some cases you will see, in the cases of the PCOS or the hypothyroidism, your most matched remedy will fail. Definitely it will fail. You will get like mad k, like why my the well selected medicine is not working at all. So in that case, you just give an intercurrent remedy, and it will be probably from the nosode group. Okay. And
Yes, ma'am.
after that, giving nosode, when the patient is coming for the second visit, you might repeat the same medicine which you prescribed before, or you can
Okay.
prescribe a mother tincture, the most similar mother tincture. In case of the PCOS, it is very hard to get the first normal periods. Okay, so in that case, I learned from Dr. Shaptoshi Banerjee, and I was really getting irritated with that one of my PCOS patient who has like a
Yes.
3 months of regular cycle. After that, it was a pause of 2 months, and she stopped taking the medicine, as because she started thinking, okay, my PCOS has been cured, so no need to take the medicine. So 2 months there
Okay.
was
Okay.
no periods. After that, she came back, and it is really hard to get back on the track and to start the regular menstrual cycle. So in that case, your well selected medicine will fail. Definitely it will fail. And if it works, then it's
Yes,
your
ma'am.
luck. In that case, you just prescribe well indicated a mother tincture, and trust me, it will act magically. By 7 or 8 days, we'll get a normal flow. So that is the smaller little tips which you will get from your seniors, nobody else. I'm following Dr. Gaurang Gaikwad, some of the video, Dr. Shaptoshi
Yes, ma'am.
Banerjee's video. So keep on watching these videos. They will give you some real tips. They will give you some very good picture of the medicine. So this
Yes, ma'am.
will overall help you to prescribe in your regular day-to-day clinical life. So I think this is bit of about my point about discussion. If you have any question, we can go ahead.
Yes, ma'am. One question from my side, even I feel that every time during my case taking, ma'am, and we have learned so many drugs and books in our colleges, college time, like body balance and everything, ma'am.
Hmm.
But what I found in my practice that this way of that I have studied my college and the patient's way and the prescription way is totally different.
Yes.
So, ma'am, many times I'm very much confused about how to correlate with all these things that how to that select this Allen's keynote or Bodic Materia Medica or Boger and BBCR or any kind of that Materia
Hmm.
Medica book. So I know that case taking is the only this way to select that Ma'am, so just I'd like to give example of mother tincture and like source sarcoidosis. So it is possible to give this all this medicine at the same time or give this step by step,
See,
go with
whenever
the
a
step by
patient,
steps.
whenever a patient is
Yes.
coming to it, you definitely, the first step is a very neat and clean case taking. There is no doubt about it. But the second thing is that how you are forming the totalities, what points you are considering. Suppose I am talking about a case of the duodenal ulcer, right? Very
Ma'am.
sedentary life. That person was working in the IT sector. Weekend,
Okay.
lots of drinking throughout the week, smoking. And if you're asking regarding the modalities, he is telling whenever he eats something, he is okay. And whenever he remains like in empty stomach, all of the symptoms getting aggravated. That is a very common symptom of the duodenal ulcer, right? So here you need to apply your medicinal knowledge of practice of medicine with the Materia Medica. In this case, if you see the like whatever medicine the ends with IUM like arsenicum album or this kind of medicine, all the medicine ending with IUM all have the modalities that relief after eating. Okay, and that is a
Ma'am.
very common symptoms of the duodenal ulcer. But in case of forming the totality, if you are considering this symptom, this will be a fail, because you are selecting the medicine on the common symptoms of the disease, but you are getting some other symptoms. Suppose if he is giving a burning sensation, and that burning sensation is again getting relief by the hot drinks or something like that, that is one of the characteristics of arsenicum. Go for it. Or burning
Okay.
sensation which is even getting relief by the cold things, or the person is always having a craving for cold, go for phosphorus. This way, these are the modalities I'm telling repeatedly, these are the modalities which will help you to differentiate one patient from another patient. Another request, don't give ever any two polycrest medicine together. Never do this. This is a one kind of crime. I said crime. Because see, if you're doing polypharmacy, what is the difference between a modern physician whom we called allopathic physician and us? They are doing also the polypharmacy. So how can we claim we are the homeopaths, we prescribe single medicine? You cannot claim, and I'm not telling, please don't take me otherwise, ki Kolkata people, they always practice classical medicine or something like that. No, you just need to understand what is the necessity of that particular hour, right? If a person is coming, like I got a patient of the renal stone. That stone was stuck in the ureter, not the ureter and the bladder junction. One of the place where that constriction is very much, and that is very much painful. I prescribed that person, or after that, whatever symptoms I got, I prescribed that person lycopodium in potency and mother tincture, and I asked him to take that mother tincture very frequently, because the person is already horrified that I have stone, and he had heard from so many places that he will die if you don't get the surgery done. So you need to make that person assured that no, you are not going to die, it is not that much severe, it can be controlled. So in that case, give that potentized medicine once or twice in a day, and just do repeat that mother tincture frequently. At least that will soothe that pain of that patient. So that is a way. And in case of the acute cases, after prescribing first medicine, your disease picture will change. See, the person will come just like my sore throat problem. Today it is like getting relief from the cold drinks. I know it will get changed tomorrow. I won't be able to drink the cold water because it will change. So in that case, you just need to have a and see, and you will give this kind of idea from your experience. Okay, what are the symptoms is going to come for the next. So you have to, in acute cases, you have to give 2 or 3 medicines, but never give 2 medicines at a time to take simultaneously. Okay, सुबह आपने नागस्वामी का ले लिया, शाम में आप ये ले लीजिए, लोबेलिया ले लीजिए. Don't do this. Ask the patient to take this medicine 3 days. After that, the disease picture will automatically change. Then shift to another medicine.
Use that drink.
Because whenever that person will come for the second time, you will understand which medicine acted last. So in case of the
Yes,
chronic
ma'am.
case, it will help you to prescribe in a better way. And in case of relationship, I will suggest always follow the boric either or nahi to
Yes,
alliums.
ma'am.
Sometimes it happens, even it happened with me. I didn't like refer the relationship chapter, but whenever I was re-case taking, that relationship जो complementary होता है ना, वो automatically will come. And जब patient जाने के बाद मैं वो medicine study करती हूँ, वो देखती हूँ कि relationship में इसका complementary लिखा हुआ है. So that is the
Okay.
calculation of 2 plus 2 4. So you don't always need to see the complementary. Okay, allium saper complementary, it is phosphorus, thuja. So we just pulsatilla. We just need to prescribe any of them. No, whenever you will be taking the case, you will automatically get the picture of the pulsatilla. Sometimes try, if you get the symptoms of the pulsatilla and allium saper goes very well hand by hand. I think if you get the patient of the chronic allergic rhinitis, it will give you 100% success. Whatever chronic allergic rhinitis case I have dealt till the date, pulsatilla and allium saper never disappointed me. But
Okay.
provided if you are getting the picture of pulsatilla, then only, not blindly. Don't listen to
Yes,
me,
ma'am.
because I from my OPD in B.H.M.S Calcutta Homeopathic Medical College, I have seen my sirs to prescribe thuja, nitric acid, and wait for the PCOS. See, your patient in your clinic will not give you this much chance. He will prescribe a nitric acid or the thuja and will sit year after year. After 1 or 2 visits, he will become anxious. Your patient will become anxious. Otherwise, he or she will leave you, right? So in that case,
Yes,
you
yes.
have to be thorough. Okay, and in that case, sometimes you need to prescribe the mother tincture. Mother tincture, my sir, Dr. Saptarshi Banerjee told me very rightly that mother tincture will buy you some time for the potentized medicine to act. And Devi, just trust me, apply this once, it will work. Because PCOS
Sure,
case is
sure.
a one of the very stubborn case to heal, to get cured. And if you can heal a PCOS person, I think he or she will bring you 5 or 6 more patients to you. So
Yes,
that
ma'am.
is
It's
a
happened with me, ma'am. Yes, ma'am.
Yes, yes. So I will suggest that don't get confused. It's very simple. Get the totality. Just focus on which point you are focusing, but don't make a wrong totality. Okay. Just the way
Yes,
I
ma'am.
just tried to give an example of arsenicum album. You cannot consider the disease picture. You have to take some of the other with the particular symptoms of the patient. That will ultimately help you to form the totality, and that totality will help you to select the medicine. It's as simple as that. And don't even,
Yes, ma'am.
I won't say that don't even follow me blindly. Whenever you will follow anyone blindly, you will fail, sure shot. Okay, so you will be your own teacher, learn from your own mistakes, but you'll definitely will learn from your own mistakes. But don't get confused, it's very simple. Just the symptoms, be it 5 or 6 symptoms, you don't need 12 or 15 symptoms to get the totality out of it. Get the 4 or 5 symptoms, make a totality. You just make to have to make that drug picture in your mind. What is silicea? How will I differentiate silicea from the pulsatilla? Okay, silicea is the
Yeah.
chronic of the pulsatilla. So you just need to continuously, you just need to keep it in your mind, so that you just don't need to open your book for referral. Definitely you can study, because there is no end of study, there is no end of Materia Medica. Keep on studying, keep
No,
on
ma'am. No.
revising the same medicine from different source, but do not apply to your practice. For your practice, keep in mind only boric and alum, that's it.
Yes, ma'am. And yes, ma'am. That's last question from my side. Ma'am,
Yes.
I think it's very important question. So, ma'am, how to handle this that material medical knowledge and this repertory both? Like repertory, we talk about repertory, this rubric and everything is come in mind. So, how to handle with this both?
So see, you whenever see what is our motive? Okay, whatever the patient is coming to us to get the relief out of it, right? Your patient is not bothered whether you're referring Materia Medica, whether you're referring Davidson of Medicine, whether you're referring repertory. Doesn't matter. It's all matter how you're healing, how you're curing. So if you're
Yes, ma'am.
getting a very clear cut picture of a medicine, that will give you a picture of the Nux vomica, maybe a picture of the pulsatilla, thuja. Just prescribe it. Don't even bother what is repertory. Repertory you
Yes.
will use only when you just need to cross reference your case. you're not satisfied with the case, you are just expecting the case must be, like recovered by this time. In that case, you just take the whole case, take the rubrics, and then just repertorize. Do not need all the time to repertorize each and every case. If you're getting a very nice picture of a drug, you will be not doing the repertorization. But if you're getting any one-sided disease like a cyst, as I told you, or warts, which the patient is not at all giving you any symptom, in that case you have to go to any repertory. You can use a boric repertory as well. It is very I recently got a patient of tinnitus. Okay, he is a
Yes, ma'am.
hypertensive patient, and he used to work in airport for long 37 years. Okay, and these
Okay.
things he didn't tell me on the first visit. He told me this thing on the second visit. And first time I gave him, considering all his totality, I gave him gelsemium. Gelsemium gave 10 or 20% relief. Okay, so I just retake the case again. I saw that is the tinnitus, and I just referred the William Boric. एंड आज जाके आप टिनिटस खोलना, विलियम बोरिक का जो रेपर्टरी पार्ट है, वहाँ पे आपको टिनिटस के अंडर कितने सारे मेडिसिन मिलेंगे जो आपको इटैलिक्स में मिलते हैं. नाउ यू जस्ट क्रॉस वेरीफाई दोस मेडिसिन विद द प्रेजेंट कंप्लेंट. So there is no hard and fast rule that you need to refer a repertory. There is no need. In the definition of the repertory, it has been told that repertory is just, वो बोलते हैं ना कि appeal करना. Like whenever we
Yes,
just
ma'am.
meet with some dispute, we appeal to the court. Okay, be it
Yes,
district
ma'am.
court,
That,
then the case will escalate. So we are
yes, ma'am.
appealing. So repertory is nothing but a place of appeal. Whenever you're not able to come up with a proper medicine by using your medicine knowledge or the Materia Medica knowledge, you're just cross-referring your knowledge with the repertory. So repertory will guide you whenever you're stuck with a case to come up with certain medicines. That is the whole and sole work of repertory. So yes, that is from my side.
Okay. Yes,
Any
ma'am.
other
Yes, ma'am.
question?
So thank you so much, ma'am, for this valuable information, because we are always confused to just start and read the repertory and open the repertory in front of patient. Everything is going on like that. So, ma'am,
Yes.
ma'am, we'll stop here because I know, ma'am, I'm not going to give you more trouble to your cup because you are not well today. And yes, ma'am.